Good afternoon, and welcome back to the Splitting the House interview segment show that we're working on here at Curling Zone. It's our second episode now. I'd like to thank Price Atkinson for joining us on our first episode. We're checking in here with Sara Shuster, who's playing with Duluth squad, playing at the 2020 U.S. Club National Championships in Potomac, Washington. The Potomac Curling Club was hosting the event. The U.S. Club Nationals, quite similar to the Travelers Club Championships that are held in Canada, where top club teams play down and participate. This event took place the first week of March, and at that time, the pandemic had not been declared. We were still really new to the coronavirus and everything surrounding it, but I think this event is a good lesson for curling clubs and facilities, associations to make sure you take the virus super seriously. I think the risk of it getting into clubs is relatively low, but really the challenge is that if it does walk in the door, we have to be proactive to figure out how to prevent the spread of it. And when you look at the situation in near Washington D.C. there at the U.S. Club Nationals, I really don't think there's any blame here to go around. I think it's important we talk about this in order to learn as much as possible and try and understand what happened here. But as this event went on, the vast majority of the players that were participating in the event ended up finding themselves coming home with COVID. And since that point, there's been a lot of discussion behind the scenes trying to look at what's going on, some potential studies coming out of this as well. So without further ado, here is Sara Shuster and an interview I had with her earlier this summer talking about the U.S. Club Nationals. This was an event that I think a number of people don't really realize, but it was one of two major super spreader events of the coronavirus. You ended up being amongst many athletes who ended up coming home with an extra prize.
Yeah, we came home with an unexpected prize, I guess you could call it, but I don't know if it was really a prize.
No, I bet not. I know you ended up being under quarantine, the entire family, for some time as well. Tell me kind of what happened at the event. This event took place beginning of March, kind of right around the time everyone was starting to become aware of the coronavirus and everything going on. From what I've heard, there was knowledge about what was going on, so there was a lot of care being taken as well.
Yeah, so to be completely honest, I probably didn't know as much about it as I should have at that point. Like, I had been following a little bit of what was going on in Italy. Like, obviously I knew it was going on in China, but as far as cases in the US, we were watching it pretty closely, and we were watching Scotland because my husband had made it to the Worlds, and we had that trip planned to the Worlds in Scotland. So we were kind of keeping our eye on how things were manufacturing themselves in the world, and the U.S. really didn't have anything. There was like the nursing homes in Washington, or there was some outbreaks in the state of Washington, but there wasn't really anything else around the country. So we kind of joked with the Washington girls, like, "Oh, we're not going to shake your hands, before the game." But really, there weren't any travel restrictions or anything like that. So I want to say at the beginning of the week, we were probably shaking hands somewhat. Like, some teams weren't and some teams were. And then probably about 3 days in, they advised us all not to do that and to just do broom taps or however else we were going to shake hands. But we were sanitizing before we went out on the ice. They had little hand sanitizer pumps, actually big ones, because you could get them at that time. Yeah. All the sheets, and before you went into the curling club, into the doors. So I don't know if people are familiar with was it the Potomac Curling Club? I don't even remember where we.
Yes.
Sorry, but that whole week was like a blur to me. But so they have two entrances to the curling club on both sides of the sheets. And so those handles were all being wiped down, and then they had hand sanitizer going in, and then they had it behind all the sheets. So people were taking a lot of precaution to sanitize their hands at fifth and break and before games and after games. They weren't letting us fill up our water bottles from like a common water bottle station, so you had to get a new cup each time. I think we were probably touching the spout where we got water. But again, they were sanitizing those things very frequently, and they sanitized the rocks in between every game. So I think, and tables were always being wiped down. The staff and volunteers and everybody there, I think, did a really, really incredible job trying to protect us with the knowledge that we knew at the time. But yeah, we somehow, almost all of us ended up with it. And I don't know that we were necessarily a super spreader in terms of like the country or anything like that, but we definitely super spread amongst ourselves there. And I think a lot home and quarantined pretty quickly, and I think a lot of us were pretty asymptomatic, so we weren't shedding probably a lot of virus. So those that came in contact with us probably didn't get it, at least as far as the contact tracing that a lot of us had. So that was good, but we tried to avoid it.
Yeah, I think at that point, I don't think there's any blame to be laid or anything like that. Like, it was so early and everything going on that the science is so new, and the evolution of it, and even the fact that, it wasn't declared a pandemic probably until middle of the week, I believe. And at that point, like you said, there was very few cases in the United States. And I think the super spreader definition is just a case of the number of people who catch it in one location.
Yeah.
And again, it's, I think these kinds of discussions, and I'm kind of disappointed there hasn't been more talk about this event. It's not about putting blame anywhere. It's about trying to learn from it and understand, because we have curling clubs looking to open in very soon. And based on everything you're talking about, the work that went into keeping things clean and protecting things, it's definitely concerning for curling clubs going forward.
For sure. I mean, it doesn't look like there's an end in sight necessarily with the virus yet. And then you think about all the kids going back to school, spreading things like they do. It's concerning for sure. I think there were a couple things that I'm not sure got done. And obviously none of us were wearing masks because, like you said, it wasn't declared a pandemic until later. I think it was halfway through the week that they said no gatherings of less than 250 people, or of more than 250 people. And then we were like, okay, we're under that. Should we cancel the event? There was talk of that. And then kind of at that point, we were like, well, we've already been together all this whole time. And really not a lot of people had even time to go out and do things in the community. So most people were just going to their Airbnb and coming back and doing it all over. So you know how curling is with those long days. But we, I forgot where I was even going with that. But I think, there were some things that weren't being done probably, like the curling club shares a bathroom with the hockey arena where people ice skate and play hockey. And I'm guessing that handle to that door probably wasn't sanitized because it isn't even curling staff necessarily that maintain that bathroom probably. So they just share it with the hockey arena. So I think all of us were probably going in and out of that door and sharing it with hockey and figure skating. So there's that. And again, maybe they were, maybe they weren't, but I know all of us at fifth and break run to the bathrooms. So
yeah, it's something. What was it? 80 athletes between the men's and women's side. I know you were talking to me earlier about numbers, and you were saying about the women's teams, just about everybody was affected by the virus.
Yeah, I saw a quick poll. We kind of had a Facebook group with all of us from it, just so we could share our symptoms and share our results from tests and share just how we can get a test and how we can donate plasma and updates on how people are doing and that sort of thing. So in that group, they just kind of did a poll. I think it was even yesterday, where they were seeing how many from each team were positive or presumed positive. And this is just the women, but it looked like there were only 2 teams where 100% of the people were not affected, and of those teams, it was 4 out of 5. So literally, women were not affected.
So two athletes out of the 40 or so that played did not test positive.
Yeah, well, and did not come away with it based on antibody tests or other things. That's what you're saying. Sorry. Exactly. I think it was a lot of us did test positive, but we were all so new that they didn't have testing sites up yet. I know even me, when I went to go get tested, I had the ability to because I'm a healthcare professional. But even then, they were hesitant to give me a test. I couldn't even get it from my own organization. Actually, I had to go to a different one. And they said the results were going to take 7 days. So it was so new at that time. Like, my husband and children could not get tested. And I know even 2 of my teammates could not get tested. But since then, a lot of people have gone to donate plasma and gotten antibody tests and had positive antibodies since. So it's not surprising to us.
So you went through this with your family and some of your teammates as well. How did everybody come through with it? Any challenges?
As far as my family, we were all good. I mean, I lost my taste and smell for a month, which was maybe not necessarily a bad thing, but but the kids, they kind of just had sword fights, jumped on couches, just like they always did. And John had a little bit of chest tightness, but other than that, really, we were pretty much unaffected. But there certainly were some very dear friends of ours that were affected more so. So definitely scary on that part. I wouldn't wish that upon anybody. I think a lot of curlers have followed one of our coaches' stories on social media, but we ended up with one intubated and had a pretty complicated medical challenging period there. So
yeah, I saw that too. Luckily he came through it, and after spending significant time on a ventilator, and it's really tough to see people go through this, and something that is affecting so many people right now. We do have one death within the curling world that I do know of. A Dutch gentleman, Christian Liebrandt, I believe his name was. And he's the husband of Sherry Liebrandt, who's the coach of the Dutch men's national team. He participates in a lot of events. He's an official for the World Curling Federation. The Women's Worlds was taking place shortly after that, and I know of a couple people who left Prince George and caught it either on the way there or on the way home. And it's certainly been something that's affected our sport to a high degree as well. So I'm just trying to reach out and get an idea of what has happened within our sport, because there's a lot of debate going on now around what we should do going forward.
Yeah, I don't know that I have an answer for that, but I definitely, as a healthcare professional, I don't think the virus is something to mess around with. I think at some point life has to continue on. Yeah. So taking the absolute most precautions you can with masks and sanitizing, and I think the biggest thing is not going around people if you have symptoms, because I think it's been shown that if you are mildly symptomatic or asymptomatic, you're probably not shedding much virus, and you're most likely not infecting many people. So I guess if curling clubs are going to open, that would be my prayer, is that if people have a cough or have a fever or have something, they stay home. And do the rest of the healthy people do whatever they can to protect themselves and other people. And it's not just about yourself, it's about the other people. Because, I'm a young, healthy female in my 30s, and I still got it. But I'm not so much worried about what was going to happen to me, but definitely some of those older people in my curling club that I love and have been part of my life for years and years and years. I definitely wouldn't want to bring that anywhere near them.
Yeah, and it's something that's kind of come out in the USA Curling return to play guidelines as well. I know they put a second version of it out, which recommended wearing masks even on the ice. I know that I was talking to the head of the USA High Performance Program right now, and he said both the US OPC doctor and the doctor at the health center in Minneapolis, St. Paul there, where the athletes train all the time, the training house, orthopedics there. He did also say the same thing, it sounds like. So it's really interesting to see the recommendation of masks, whereas in other places they're sort of getting away from that a little bit. And
yeah, there is a lot of controversy on masks just because the data doesn't necessarily show that they're all that effective, but I think it's the fact it doesn't protect you or like me to wear it, but me wearing it will protect you from getting it from me. I believe that is where the science sits right now. Correct? From what you've heard? There's a lot of data out there that I'm not really sure what to believe sometimes, but yeah. I did see a funny little thing that was showing two people standing next to each other, and they were both wearing pants, and it said if so and so pees on you and he's wearing pants, you're going to get a lot less on you than if you
yeah, exactly. And yeah, that's sort of the idea, right? Like the whole thing with curling, some of the science that's coming out is the fact that the temperature of a curling rink is right around the perfect point for the virus to be viable. This is something that came out from the SAGE group in the UK, which is essentially their emergency medical group that deals with this stuff with government and so on. The whole idea about yelling, so calling those line calls, you're sending your particles out into the air at a good distance. So it'll be interesting to see what we see coming out of this in the next few weeks and where curling clubs do end up going.
We'll have to go to hand signals and summer conditions. Curling, winter conditions inside.
There you go. So appreciate your time, Sarah. Thanks for filling us in on the U.S. Club Nationals, and I hope everyone is doing well, and look forward to seeing you somewhere again on the curling circuit.
Yes, I sure hope so. Thanks, Jerry.